Hey, this is Josh with Iowa American Rescue, and today on the Medic Minute, we're going to be looking at part 2 of sucking chest wounds, where we look at some ways to improvise a chest seal. In part 1, we saw how to use a commercially available device, and now we're going to start off with an option that many of you are going to have in your place of work, even though you might not necessarily carry one around in your truck. An AED pad is a great way to improvise a chest seal. It's not going to be vented like the commercially available chest seal that we used, but it will help slow down the development of a pneumothorax or a tension pneumothorax because of a sucking chest wound. For this reason, it could be a good idea to talk to your boss or whoever the safety supervisor is at your location and see if you can keep the old AED pads after they become expired and are replaced with new ones. They make excellent training AED pads, as well as you can keep them around for an instance like this. The next type of improvised chest seal we're going to look at is using a petroleum gauze type bandage. In this type of chest seal, the bandage, as well as the package it came in, is actually used as the chest seal. You'll see here some of the difficulties of using tape with gloves, and I deliberately didn't want to edit that out just so that you can see the reality of some of these sticky items with gloves that you should still have on. Something else that you'll notice is how I pre-stage the tape. This is just something that I learned to do when starting IVs, and it makes sense here. You don't want to have to be tearing off this tape and trying to manage that while you're also holding down an occlusive dressing over a wound that's going to be bleeding. Apply this directly over the wound just like you would with any other chest seal, and then tape down the 3 sides to give you a vented seal. The reverse side of the packaging also works well, and you'll see how that is almost identical to the space blanket or the mylar type blanket that you might see in an emergency preparedness kit. Basically anything that's not going to allow air to pass through it can be used as an occlusive dressing. Even a sandwich bag could be used. Having the ability to improvise these chest seals may not make a tension pneumothorax any better, but it will prevent it from getting worse or from starting at all if you can get to the patient early enough with this intervention.